Welcome to the Stay Healthy El Paso podcast, where we help El Pasoans get away from taking pain medications, avoid getting injections, avoid surgery, and keeping up an active lifestyle. This podcast is presented to you by Dr. David Midoff, expert physical therapist and owner of El Paso Manual Physical Therapy. It is our goal and intentions to provide you with valuable tips and insights from experts in the El Paso area so you too can stay healthy, fit, and energized. Now here's your host, Dr. David.
Hey there, this is Dr. David, physical therapist from El Paso Manual Physical Therapy. Welcome to the show here. This is our first official episode for the podcast. And in order to bring this in right, to get a good start, I wanted to bring on my lovely assistant, Amber, here. She works in our office, and she's a person that you'll talk to if you ever give us a call. You'll love talking to her. You'll hear in just a moment. But we'll be bringing on, just to give you the update about how we're going to progress with this. It's not going to be always me on the podcast being interviewed. In fact, it'll rarely be the case. This is just the first one, but in future episodes, you'll be hearing from physicians, acupuncturists, other medical professionals around town. The point of this podcast is to highlight other medical experts in El Paso. And so I just wanted to introduce you guys to us at El Paso Man Physical Therapy first, and then we'll definitely be giving you the tour of a bunch of experts from El Paso. So without further ado, Amber, welcome onto the show. It's nice to have you here.
Thank you, Dr. David. Hi, thank you for having me.
So Amber's been working with me for coming up on a year now.
Yes, about a year now.
It's been a wild ride with her. Things have gotten so much more happy, cheerful, and lighthearted in the office.
It's been fun. We're having a great time. It's been awesome.
It's been tons of fun, and I've got to know Amber and her two boys and her husband. We have kids roughly the same age. She's a little bit older than mine, but they love hanging out whenever they get a chance to be with each other.
They do. They're awesome. Good kids.
Yeah. So Amber, you're going to interview me. Go
Absolutely.
ahead and ask away wherever you want to start.
All right, Doc. Let's start here. Tell me your name, and where you're from, and where did you go to school?
Let's do it. So my full name is Dr. David Midoff. I'm a physical therapist. I've got a doctorate in physical therapy, and I did some advanced postdoctorate training, and that's called a fellowship. And what FAAOMPT stands for is a Fellow of the American Academy of Orthopedic Manual Physical Therapists. It's a big mouthful. The gist of it is, let me start in high school. I'm from El Paso, Texas. I went to high school at Jefferson High School. And I didn't go to the Silva Magnet Health School. I was not in the medical field at that point, so I was not interested at all. I ended up going to UT Austin for undergrad. I got my bachelor's in kinesiology there, and it was during that time that I learned about physical therapy, and that's when I decided to do it. Then I went straight into physical therapy school. It was a doctorate program at Texas State University, just down the road from Austin in San Marcos. And immediately after that, I started working in Austin as a PT, and then went over into the manual therapy program, also held there in Austin and San Marcos. All that mouthful, the FAOMPT stuff is just, I'm a specialist in handling and doing hands-on work and helping people prevent surgeries and get off of medications and get back to being active and healthy.
Awesome. So tell us a little bit about your lovely company that's awesome here.
Yes. We've been going on for almost 5 years now, and currently we are located at 2601 Yandell in Suite 232 in Central El Paso. We're in the office here looking out the window. We can see the Franklin Mountains. You see the antennas on top. It's actually kind of a windy.
We have a cool view here. It's really nice.
Yeah.
So we got a good spot.
Oh yeah,
good
I love the view here. And we currently have a couple treatment rooms and a nice little comfy home setting type office. I love it. The last patient that was here this morning was just commenting about how it feels like a home more than a medical office.
Right, I love it. We have a good environment. It's a great place. I like being here.
Oh yeah, people kick off their shoes here and walk around their socks or barefoot and they just feel at home.
It is. It's like family here. It is really, it's a great place to be. So now tell me, why did you start your own practice?
Yeah, great question. Started because I just knew that I wanted to be able to treat patients one-on-one with the skills that I have in orthopedic manual therapy. So the hands-on skills, it just requires time, one-on-one time, and then the education piece that happens and showing them the right proper exercises to do everything that's right and necessary to avoid a surgery and avoid living a life on painkillers. I just needed to be one-on-one, and all the other practices that I've worked at, the business models that I've been in, they have overlapping appointments where they see at least 2, sometimes 3, 4 more patients all at the same time, and everybody's kind of doing cookie cutter treatments for knee problems, back problems, whatever it is. And I wasn't a good fit for my skill set, and I just knew I could help out people better if I had them one-on-one. So that's what we do here, is it's all one-on-one appointments.
Right, and we do have those one-on-one appointments. I wanted to say that for sure. Now, tell me something unique about your practice.
Yeah, so besides the one-on-one appointments, a lot of the visits, if I had to give it a percentage, probably 95% of every visit is pretty heavy with hands-on skills and techniques that we implement with our patients. And basically patients they're here for the stuff that they can't do on their own. We teach them what they need to be doing on their own. But of course, getting a certain joint loosened up or muscle unstiffened, or just getting them to move the right way. Like a lot of people move funny in their knees and don't even know it, and we have to just put our hands on them and guide them through the motion. That's something that we truly take the time and get our hands on people. And even with initial visits here, the first time people come in, we do what's called the discovery visit. We get our hands on them and we check out their knee problem, their hip, back, or shoulder problem, whatever it is that we're seeing. And it's a big drastic change from other medical offices that might just talk with them and run a diagnostic test and never put a hand on them and try to come up with a diagnosis without having laid hands on them. So we touch everybody so that we can do the best job possible.
Nice. Can you tell us a little bit about knee pain?
Yeah, knee pain. Oof, that's a doozy for sure. Well, we see knee pain people all the time here. It is definitely one of the most common problems that people go get surgery for, and it can be completely avoided. I'd say in 9.5 out of 10 times.
Which we definitely do see around here a lot. Coming in, they were going to have surgery, and then they walk out of here in a nice little time frame.
Yeah.
We've seen it quite a few times.
Just a couple days ago, Suzie was in here. So she came in for a meniscus problem, and her first visit, she had an MRI. It showed a torn meniscus, and she was doing some stuff with her church. She took a funny step. Her knee popped and swelled. She was on crutches for a while, freaking out about possibly needing a surgery. She's in her later 50s, and she loves to be able to move fast, clean her house, take care of everything she needs to at home and with family and friends. And she loves going out to visit people. She just was all of a sudden slowed down tremendously. Fast forward to today, she got hurt in December.
Today, hold on, let me stop you right there. Let me go back to a few days ago, when she was in here doing weighted squats.
Yes.
Okay.
Yeah, it's been 2 months, yes. And she had a 45-pound bar on her shoulders and was doing squats.
Unbelievable. When she came in, she was on crutches. Yeah. So it's pretty awesome. It's really cool.
And she's got to do that because it's just the way to prevent the problem from happening again. So not everybody will do squats, but it's just a great testament to how fast people can improve and never have to have a surgery.
Right. So what got you interested in doing this knee pain, what got you interested in this overall?
I have had knee problems over the years. When I was in high school, I played football, I did track, I did cross country. I've just always been active. My years as a personal trainer, I did competitive running as well. I've had patellar tendonitis. I've had this really rare injury called the posterior lateral corner injury on my right knee. I thought I was going to have surgery a couple years back, and I was able to. As soon as I heard those statistics about having to have surgery for that, I said, hell no, what can I do to make sure this doesn't happen? And so I've always been interested in the knee, and I've been able to thankfully help a lot of people with their knee problems as well. So it's just a fun joint to deal with, and I always have to look at contributions from the foot and the hip and even the back. And it's just an awesome puzzle for me to solve. I love, it's just entertaining for me. And even, on another level, it's just, I'm passionate because it's so rewarding when I get people like Suzie that come in and it's like, you went from crutches to weightlifting, in a matter of weeks. That's incredible.
Right on. So, okay, then what makes you an expert?
Well, I've got all, I've done the training, beyond the doctorate in physical therapy. Well, first off, not every PT is required to have a doctorate degree. There's plenty out there practicing with a master's and even with the bachelor's. And many of them have gone through extra training and are definitely pretty darn good. I just, the doctorate levels, just, that's the pinnacle. And then I've done the postdoctorate work. So I'm a specialist in being able to, by hand, assess and treat and the knee and other parts of the body, but also with the exercises, the movements that we use, the focused exercises. Those are critical for making sure that the problem doesn't return. I've seen tons of knee injuries and some really, really bad ones that have gotten way better. Of course, we see the post-operative knees. Those are kind of easy because they've already had a surgery and we know what was done with the surgery. A surgery is pretty much a controlled injury. They're slicing you open and then nipping certain things and sewing it up.
No, thank you.
Yeah. But when it's nice afterwards because the rehab process is straightforward because we know what was cut on. But if there's never been a surgery and you have an injury, then it's kind of a puzzle to figure out, and it's not always something that the surgeon might be an expert in, or even a physician. Somebody like me, a manual physical therapist is the best person to see for an injury that's never been addressed surgically, something that you're looking to treat without surgery. And then if it's a mechanical problem, meaning there's a meniscus problem, a cartilage, muscle, bone, joint, ligament, tendon, all that stuff, it has to deal with the mechanics, nerves as well. It has to deal with the mechanics of the joint. That's right up my alley. That's what I live and breathe every single day of my life.
Right. Okay, then. So why should people here in El Paso come see you for knee pain?
Yeah, well, to my knowledge, we're the only clinic in town that specializes in avoiding surgery and getting off of painkillers and being active. Most other clinics, they may not outright advertise or talk about themselves as being specialists in any certain way, but they tend to see a lot of post-operative cases. In other words, the ACL repairs, the total knee replacements, the meniscectomies where they cut off a chunk of the meniscus, and that's all they see all day long. And they're really good at doing that. They're fantastic at doing that. In fact, if you have a surgery, you're probably going to do really well at just about any PT clinic here in town. But if you're looking to avoid one of those surgeries, then that's a different ballgame. If you're talking to a therapist that day in and day out sees post-operative cases and you've never had a surgery, they're just not going to be a specialist. It's kind of like if you drive a Mercedes-Benz car and you take it to the mom and pop dealership and you see a bunch of older lower end cars parked in the shop, you might want somebody with a little more skill to deal with your Mercedes-Benz so they can get back up and running.
Right on, I'm with you with that. Most definitely, absolutely. And I can actually say that. I do get to see a lot being in the clinic with you. I do get to see the before and after of when the patients and clients come in. And it's really neat to see that they come in here with sometimes little or no hope. And then, in a short time, they're walking out of here without a surgery. It's really awesome to see it from my aspect, from my point of view. And to actually be able to talk to everybody, I fall in love with them and I hear their story, and it's just amazing that they came in here just so beat down and ready to have surgery and give up on everything. And some people like Martha, she told me she was at the end, there's nothing anyone could do for her. And she is at home and her daughter called me, please tell my mom to stop sweeping the driveway. She's doing too much. It's just amazing that I get to see these people firsthand. And I think it's really awesome and it's really neat. So I want to know, someone here in El Paso, when should they reach out to you?
Yeah. So, if you have knee pain that just started today or even in the past couple days, that's not a situation where, call us right away. Now, if you have a chronic problem, like it's been ongoing, comes and goes for months or even years, then there's something that's not happening right in order to get you out of that situation. That's when somebody like me could definitely make a big change. Our clinic is set to help out people like that. So if you, let's say you sprain your knee, you take a funny step and it swells up and you can't move it very well and you're limping, give it some time. Try the natural stuff. You might even try a little pain medication, over-the-counter type stuff, as long as your doctor's okay with it and you don't have any issues with that. Simple pain relief treatment might get you through that. If you feel like you're 100% after a week, no big deal. That's not a point to call somebody like us. But if you've been swelling ongoing for weeks, months, years, if you feel like sometimes you need a cane or a crutch to walk on, that's definitely a point to call us. The most common reasons people call us for knee problems, though, is they can walk, they can do everything, but when they do a little more, like if they go to the gym and start jogging on the treadmill or get on the elliptical, or if they have to climb, go up or down a lot of steps, or they go for a hike because it's nice, the mountains are really nice hiking areas, and then they have knee pain, and it's frustrating when every time they try to be active or cleaning the house, getting down, kneeling and squatting down to get down to the lower places, the floors and all that. A lot of people have trouble with that, but everyday things, it's no big deal. Another one is people that get knee pain after sitting for too long. They might be fine most of the time, but if they've been sitting at work for an hour or more, or going to a movie and their knee just aches in the first few steps after they've been sitting for a while, or if they've been asleep and then they get up, those first few steps can be very painful in the knee. That's a situation where there's some underlying problem that needs some sort of specialist help. You want to give us a call and discuss what kind of options are available to you for fixing this knee problem, because you should not be living with knee pain, no matter how old you are.
Right.
It's not normal. A lot of people say that, though. I'm old, I'm getting old, so it's just part of getting old. But
no,
you could be 70, 80 years old plus and feel fine.
Absolutely, yes. So what is something helpful that you often share with your patients that they usually don't know?
Yeah, so arthritis is a huge problem in the knees. And a lot of people are told, especially as they're getting into their 50s and 60s, if they have a knee problem, the typical routine is they'll go to the doctor says, well, let's get an x-ray, let's look at the knee. Then they go back for the follow-up results, or maybe if they do it in the office, the doctor shows them on the x-ray, hey, here's your knee, and you see this bottom edge where the joint is, that's all arthritic. You have arthritis in your knee. And then the doctor just isn't a specialist at rehabilitating that. They're a doctor of medicine usually, so they're looking to help you with medicine. They'll just tell you something like, it's because of your age and you're only going to get older and your arthritis is going to progress and that's why your knee hurts, and they might just leave you hanging there, and that's the best they can do with the knowledge they have. The reality is, what most people don't know is you can have painless arthritis. In other words, say you're same situation, you go to the doctor, you get the x-ray, they show you the arthritis, your knee's hurting, that's why you went to the doctor. If you do treatment kind of like we might prescribe, you can get pain-free, be able to go up and down the stairs, be able to hike the mountains, be able to walk your dog, clean the house, do all the stuff that you like to do without the knee being an issue, without it swelling. And if you were to go back and get an x-ray, your knee would probably look the same with that line of arthritis inside the joints. As long as the arthritis isn't super severe, your chances are you're gonna do really well despite the arthritis.
Good. Now, do you have anything else you'd like to share with our wonderful El Pasoans?
Yes. So we are also really good at treating back problems. We see a lot of people for disc herniations in the back, a lot of muscle spasms, pinched nerves, sciatica problems. We also see people for neck problems and nerve problems associated with the neck, like they call it radiculopathy, but people get like numbness and tingling in the arms. and shoulder problems. A lot of people complain of knots in the neck and shoulder area, and it can get pretty bad to the point where people can't focus and concentrate on just their work, on their family, their relationships. The worst is when people say they go home grumpy.
Or they want to go to the emergency room.
Oh yeah.
That one I went through with my lovely Jordan.
Yes.
That was fun. And I'm like, no, Jordan, come here, please.
Yeah.
And so she's one of my favorites. She came over, she was actually stuck, bent over.
Yeah.
And she couldn't even stand up.
Yeah. Poor girl.
So I mean, she's one of my favorites by far.
Yeah, and we talked to her, and she was thinking of coming here versus she was either here or the emergency room.
Yes.
And
we talked to her right before going into the emergency room.
Right, and and of course she didn't know what to do about her problem, and I called it. I said she's probably going to get muscle relaxers and pain relievers,
yes,
anti-inflammatories. They might do an injection, and then tell her to go home and rest. And that's like the worst thing you could do. I mean, if it calmed her pain down, so she could actually sleep and that kind of stuff, but it didn't go away. It just masked the symptoms. But when she started coming here, she started progressing week by week, 10, 20, 30%, and the girl's lifting weights now.
Yes, she is, and she's doing wonderful. She just called me, and she's like thanking us again. So just so you know, dog, she did say thank you again.
Awesome.
So if someone else in El Paso wants to learn more about our clinic, and possibly even make an appointment, what's the best way to get in touch with us?
Yeah, super easy. So you can look on our website. The website is epmanualphysicaltherapy.com. It's kind of a long website, so if you have trouble spelling it, just Google El Paso Manual Physical Therapy, and you should find it right away. The phone number here is 915-503-1314. And if you call that number, you'll get Amber.
You're going to get me. You're going to talk to me.
And you'll have a fun time talking to Amber. And what I love about what Amber does is, most people calling our clinic are not the happiest. They're dealing with
No, they're not.
dealing with a problem. They're on the verge of going to the ER.
Yes,
it's that kind of situation.
Yes,
and Amber makes you feel so much better.
Oh.
She makes you feel glad that you called the right place.
Thank you. Yeah.
And I frequently get people come in once they see me, because they'll talk to Amber first.
And I'm real, yes. You will come in and meet me after you talk to me.
Yep.
I'm a real person.
Yep. And she'll be in. I'll have patients in the treatment room, and they'll say, "I love talking to Amber." And there's many times where I'm even done with one patient, and the client before that's still there talking.
Yes,
to Amber.
they are.
She's
sorry,
like,
doc. They are. They do stick around. Sorry.
So
yes.
it's it's really nice when you're having a rough spot because of your knee or your back or whatever it is, and you have a ray of sunshine to brighten your day.
Oh, well, thank you. Thank you so much. Yes, and I do love having everyone that we have in here. They they've really turned into be like really good friends, or even like our family. So.
Oh yeah.
It's been really fun. It's awesome.
Mm-hmm. Yeah. Well, thanks so much, Amber. I really appreciate you.
Well, thank you, Dr.
coming
David.
on.
Thank you.
Yeah, I hope to do more. Maybe we'll hear from you in the future as well.
Absolutely.
And to those of you that end up meeting us one day, you'll definitely love meeting Amber.
Oh, well, thank you, Doc, and the same to you.
Have a wonderful day, everybody.
Bye-bye.
Thank you so much for listening to the Stay Healthy El Paso podcast, brought to you by El Paso Manual Physical Therapy, where we help El Pasoans get away from taking pain medications, avoid getting injections, avoid surgery, and keeping up an active lifestyle. If you'd like to learn more about what El Paso Manual Physical Therapy can do for you, call 915-503-1314 or visit our website at epmanualphysicaltherapy.com. Mention this podcast for a free discovery visit valued at $100. If you enjoyed what you've heard, please be sure to leave a review on iTunes and follow the show on your favorite listening platform so you won't miss an upcoming episode. Tune in next time to get the best health tips from experts in the El Paso area.